Goodness, those sounds and sights of people clapping for healthcare workers just really moving. Joining me now is one of them, Dr. Daria Long. She's an ER physician, clinical assistant professor at the University of Tennessee. Doctor, thanks so much for coming on. It's great to have you on because I think folks are used to hearing accounts from cities like New York or more and more a place like New Orleans, seldom from Tennessee. Can you tell us what the outbreak is like on the ground there? Are you seeing the first signs of this spreading widely?
Yes, Jim, good morning. Thank you for having me. And, you know, just in that last segment, a lot of Americans have heard about the shortages that we are having. We're now seeing an even new iteration, and we're seeing this across the country, is that hospitals are reaching out to doctors to say, are you comfortable practicing in another specialty? Because we know we're going to have shortages of ER and ICU doctors. My husband's an orthopedic surgeon. He got one of those emails too. What we need to be focusing on is not letting our doctors get sick in the first place across the country.
No question. Well, let me ask you this, because of course a concern is that many doctors and healthcare workers don't have sufficient protective gear as they're treating patients. Do your colleagues feel like you're risking your lives as you treat the infected?
We do feel that we're not getting the protection we need. And they do say that ER doctors were kind of the MacGyvers of medicine. So I have seen many of my colleagues on talking to them making masks out of items from Ace Hardware. I have another colleague who's testing if it's better to clean her mask using a rice cooker or a dehydrator. We're having to be pushed to that level. One thing I do want to say, this cannot go unnoticed, is that we are watching out and sharing even our precious resources with each other, physician to physician. And it's very encouraging to see fellow physicians standing above the fray and reaching out, looking out for each other, even with our very little resources, to take care of our fellow each other, our community, and to take care of our country. And that cannot go unnoticed.
Yeah. Listen, it is not. You guys are doing great stuff and deserve credit. I want to ask you, because a lot of hospitals are saying when this peaks, when the cases spike, they're concerned their facilities will be overwhelmed. They won't have enough ventilators, for instance, and they'll have to be rationing health care. Is that a prospect you're now preparing for?
We all are very concerned about that. The reality, Jim, is that our hospitals and our ICUs run at 100% capacity even before we have the COVID pandemic or whatever is going on. So we know when something comes in like this, we're going to have more demand. And we are seeing states fight for resources and precious resources. So yes, I'm definitely concerned that once we see that peak, we won't have enough of the ventilators, the masks, the medications, the doctors, any number of things. And we're going to have to decide where to allocate those resources, which is not a decision that I or any doctor wants to be making.
No, it's a remarkable reality. But before I let you go, the infected, they often have to suffer on their own. No contact with their families to reduce the risk of spreading this to others. What is that stress like on patients?
You know, that's a great question. And as an ER doctor, yes, I view my job as giving somebody medications and doing diagnostics, but just as much a part of my job is reaching out, is holding that patient's hand, is helping them find ways to connect with their loved ones. That's still part of my job for my patients in the ER and for our greater Americans, to help them connect with each other, to help all of us as we go through this very scary and uncertain time, to be there and help them connect.
Yeah. Listen, thank you so much again, and we wish you, we wish your team, and we wish all the people you're treating there the best of luck in the coming days and weeks.
Thank you so much.